We're now going to demonstrate applying a sling to a patient in a chair. This time we have assistance of two. We're going to use two flat sheets and we're going to apply the sling in the middle of the two flat sheets. So myself and my colleague have got either end of the slide sheet. We're going to be facing forwards in our fab stance, and on the word slide we're going to bring the slide sheet all the way down to the seat. Ready, steady, slide. And then we're going to grab hold of the other one. We're going to do the same again. Ready, steady, slide. So we have two slide sheets in place. The top one, just gently draped over the patient, and then the sling's going to be put down in between the two slide sheets. So making sure that the middle of the sling is in line with the spine. So either side, in our fab stances, ready, steady, slide. And that goes down nice and easily in between the two flat sheets. From that position there, we can then remove the slide sheets. And we just want to make sure that the top of the sling is nice and symmetrical to either side of the spine. My colleague is then going to use a slide sheet mitt to be on the right side of the patient to start to bring that sling around the hip and underneath the leg.
So my patient can lean towards the left side as I bring this one around. And I'm using the glove just to smooth out any creases and get it to come nicely under the buttock. And then back to the middle.
And on my side, I'm going to use a roller sheet. So from here, if I can get you to lean over that way a little bit. And I'm just going to put the sling through the roller sheet. And just bring that sling forwards a little bit to about the same position as the other side. Okay, I'm going to sit back in the chair. Okay. My colleague's now going to bring the sling underneath the leg so that we've got the leg straps coming up through the middle. I'll get you a step, Sean.
Yeah. To do that, we're going to use a stool. Although this is two-tiered, I just need my patient's foot on the lower one. If the patient can do that, that's fine. If not, they might need a little bit of assistance. And what that gives is a little bit of a gap between the thigh and the chair. So in my fab kneeling position, I'm going to hold on to the straps. I'm going to place the glove between the thigh and the chair, the thigh and the sling, and then I'm going to bring it through by gently leaning backwards to bring that one through.
And I'm going to bring the other leg through, but this time using the roller slide sheet. Using a similar technique. And again, I'm just going to use this. If you don't have access to a stool or a step of any sort, then a bath step can always be ordered from Mediquip, which is a very useful thing for somebody to put their foot onto. So coming in from the side, all right to pick the foot up on there. And all I'm doing here in my fab stance is just bringing that through. And it's nice and slidey because we've got that roller sheet there. Thank you. And our patient is now ready to be hoisted.